Hello, I'm Christiansen, president of ACT's Retirement Life Communities. Welcome to a special edition of ACT's Vision, Our Journey Forward. Joining me later in this episode will be ACT's Chief Medical Director, Dr. Paul Reinbold. As we've promised from the start of the pandemic, given the recent news of the Omicron variant, we continue with our efforts to keep you well informed about our nation's battle with COVID-19 and its impact on our communities. As encouraged as we are on our progress against COVID-19, our experience as a nation has taught us that we must remain vigilant in this battle, as we know how quickly things can change. This is particularly important as the weather turns colder and as we approach the holidays when people gather indoors in celebration with family and friends. As you are surely aware from media reports, COVID-19 rates throughout the country are unfortunately on the rise again, and a new variant called Omicron has been identified. We are thankful that due to our high vaccination rates and safety protocols, active COVID-19 cases continue to be uncommon within our communities. This gives us great confidence that despite the rise of cases across our nation and the introduction of a new variant, we are not making changes to current protocols or implementing new protocols. As Dr. Paul will review in more detail, early data suggests that while the new variant appears to be highly transmissible, the good news is that booster shots of the COVID-19 vaccines continue to offer the best measure of protection from contracting the coronavirus and its variants. The CDC recommends that individuals receive a booster shot 6 months after receiving their initial Pfizer or Moderna vaccine, or 2 months after their initial J&J vaccine, as scientific data suggests that efficacy may wane over time and a booster offers additional protection from severe illness and hospitalization. While we have completed booster clinics across our communities, boosters are now readily available at local pharmacies and healthcare providers within the greater community. If you haven't already, we recommend that everyone get the additional COVID-19 booster shot to give yourself maximum protection against the virus. When you receive a booster outside of ACTS, please provide a copy of your vaccination card to your immediate supervisor if you are an employee, or to the wellness office if you are a resident. This will enable us to properly document your status within our tracking system. We thank you for your cooperation in this matter. We understand that it has been a long journey as we've battled the coronavirus together. Our ongoing efforts remain consistent with the guidelines and recommendations of the federal, state, and local health authorities and focus on the health and safety of our residents and staff. As we enter the holiday season and move into the winter months, we must remain vigilant in following safety protocols due to an increase in the likeliness of potential for exposures. We all play an important role in ensuring each other's well-being by making good decisions and minimizing our exposure risk. Throughout the course of the pandemic, we have reminded residents and staff of the importance of hand washing, social distancing, and monitoring our own symptoms. We continue to highly recommend mask wearing on and off campus, especially when in common areas and crowded spaces, and in locations that remain in the CDC's high or substantial transmission rate categories. Additionally, we ask that both residents and staff continue to inform us of potential exposures to COVID-19 and self-monitor for symptoms such as a runny nose, cough, fever, or shortness of breath, so that we may assist in taking necessary safety precautions. If you have symptoms, even very mild ones, please self-isolate until you are no longer symptomatic and test negative. We remind staff to please promptly notify your supervisor of any symptoms, or if anyone in your household has symptoms, has a pending COVID-19 test, or tests positive. Thank you for continuing to do your part to help the battle to contain the COVID-19 threat and keep each other and our communities safe. And now it is my pleasure to welcome ACTS's Chief Medical Director, Dr. Paul Reinbold, for the latest information on the Omicron variant and other news from the medical community related to our battle with the COVID-19 pandemic.
Thank you, Karen. Today, I would like to provide an update on the status of COVID-19 in the United States, discuss the Omicron variant, and then review the impact that it may have on us and our current vaccines and therapeutics. Currently, cases of COVID-19 in this country are increasing. At this time, these cases are essentially all due to the Delta variant and are the result of increased transmission during holiday gatherings, as we have seen previously. Cases continue to be more common in those that are unvaccinated, and those that are vaccinated continue to have a markedly lower chance of hospitalization or death. ACTS residents continue to benefit from near universal utilization of boosters, and I encourage ACTS employees to attain this goal as well. For those who previously received the Pfizer vaccine, a booster has now been approved for those as young as 16. If you are eligible to receive a booster, you should do so as soon as possible. After the administration of 8.5 billion doses, it is clear that all vaccines continue to remain safe. We now know that the immune response elicited by vaccinations and COVID infection decreases with time. However, a booster vaccine dose can restore efficacy of nearly 95% against Delta and prior variants. Omicron appears to be 2 to 3 times more transmissible than Delta, but does not appear to cause more severe outcomes. More data is necessary to confirm these findings. Importantly, the vaccine booster effect worked against Omicron as well in initial studies done by Pfizer, which predict the booster will likely achieve an efficacy of at least 75% versus this new variant. More studies and results are coming soon, including information from Moderna and Johnson & Johnson. Booster doses play an immediate and critical role in the battle against all variants of COVID-19 now, but they will not be our only defense as we journey forward. Multiple companies continue to work on novel vaccines, and both Pfizer and Moderna have stated that they can deliver Omicron or other variant-specific vaccines in 90 to 100 days if it is determined they are necessary. 2 new oral therapies from Merck and Pfizer are predicted to remain effective against all strains of this virus due to their mechanisms of action, which are unlikely to be disrupted by current or future viral mutations. Pending all approvals, both therapies should be available for use within 3 to 4 weeks. Injectable monoclonal antibody therapy options continue to expand, providing additional options for both treatment and prevention of COVID-19, and they have resulted in few adverse effects. A recently approved antibody therapy from GlaxoSmithKline has demonstrated sustained efficacy versus all current variants, including Omicron. Existing monoclonal antibody treatments are being reformulated to more effectively match the changes necessary to thwart Omicron, and it is expected these modified products will be available soon. Another just approved monoclonal antibody injection is now available for prevention of COVID-19 in immunocompromised individuals that do not achieve an adequate response from vaccines. These injections could be given on a recurring basis every 6 months or so to provide these individuals with effective immunity. Thankfully and reassuringly, all current familiar measures, including distancing, masking, and hand hygiene, remain effective and crucial components of everyday efforts to mitigate viral spread. It remains very important to recognize that any symptoms of cold or flu should be considered to be COVID-19 until proven otherwise. Those that have these symptoms should stay home and away from others, get tested, and follow up with their primary care provider to determine what further measures are necessary. Please also remember to get your flu shot. This additional protection is more important than ever as we enter flu season with all respiratory infections trending higher. We continue to have an increasing number of therapeutics and interventions today that we could only hope for at the beginning of this pandemic. Because we have these many options, additional restrictions and protocols are not necessary at this time, as Karen mentioned. These current and soon-to-be available tools ensure that we will continue to be successful in overcoming the challenges presented to us by COVID-19 and its variants. Thank you.
Thank you, Dr. Paul, and thank you for watching this episode of Axe Vision, Our Journey Forward. Rest assured, we will continue to monitor the latest COVID-19 developments and will communicate pertinent information to you. Thank you again for your continued patience, cooperation, support, and prayers throughout the year. We could not be more appreciative of the collective actions of the entire Axe family. It is hard to believe that we are well into the holiday season and the year 2021 is quickly coming to an end. On behalf of the entire Axe leadership team, it is our wish that this upcoming holiday season and the new year ahead brings you and your families many blessings and is filled with hope, joy, and love. Thank you for being a member of the Axe family, and may God continue to bless you, your family, and the entire Axe organization.